Aloha! Thank you for joining me. I'm Dr. Catherine Taketa-Wong, and I'm just going to jump right in today. At some point in their lives, most women experience the uncomfortable symptoms of PMS. We see mood swings, the irritability, breast tenderness, headaches, migraines, fatigue, bloating, and sleep problems. I don't believe women should have to just suffer through this time of the month. And I know that heavy drugs and hormone replacement therapy aren't the only answers. There are natural remedies that are not only safer and have little to no side effects, but can also be more effective both over the short term and over time. Thank you for joining me today. As a naturopathic doctor, or ND, I attended a four-year medical school, just like MDs do. I was trained as a primary care physician, and as such, I ordered lab tests, write prescriptions, and do school physicals, the same as any other doctor. But with naturopathic medicine, there is much more. In the United States, did you know that fewer than 20% of medical schools require any courses in nutrition? Of those, the typical offerings are fewer than 25 hours of nutrition. That's 25 hours in 4 years. Naturopathic doctors, by contrast, typically receive 155 hours in order to be trained in the power of nutrition to build health from the inside. Applying that knowledge to a patient's condition takes a lot more time than just prescribing pills. My office visits are a full hour. In addition, I'm also a licensed acupuncturist trained in Chinese medicine. This allows me to include Chinese medicine prescriptions in my practice and to be able to incorporate Chinese medicine philosophy. And this is because my goal was to educate myself as widely as possible, because my passion is to help people not only get healthy but stay healthy. I love caring for my patients and believe strongly in working with them as partners in their health and well-being. If you have a health condition you would like to talk with me about, please call our office and schedule a free phone consultation. There is no charge because I don't take new patients without reviewing their situation first. We discuss your health concerns and come up with a plan to help you. To schedule a free consultation, just call or text our office or click on the link in the post. All the contact information is here on our Facebook page. So let's get started with today's event, which is about how naturopathic medicine typically treats PMS, and that can include menstrual cramps and migraines. Please feel free to use the comment section to ask any questions as the talk progresses. I want to start with a story about one patient felt was a medical miracle. Just a note, I'm using a pseudonym to protect her confidentiality. Janice was a mom with 2 children, aged 8 and 5. Before the birth of her first child, she had mild PMS, cramping, and headaches, but things weren't too bad. After her second child was born, her periods literally became a nightmare. She had terrible insomnia, waking up 3 to 4 times a night. Melatonin didn't help at all. Every month, 8 to 10 days before her period, Janice became highly emotional. She felt depressed. She would cry all the time. She would often get cold sore blisters in her mouth, and her head ached. And she would feel that from the top of her head down to her neck. And her eyes also would tend to feel swollen and hot. When Janice would get a migraine, it would be accompanied by awful nausea. She tried taking medications like estrogen to help with the pain, but she had really nasty reactions to the drug. She had profuse sweating and vomiting. She felt dizzy and lightheaded. And the poor woman was living on coffee to help with headaches and energy because she was so exhausted from lack of sleep. I've actually had many women patients who've told me about how drinking coffee helped their headaches and low energy, even though they didn't always like the jitteriness that it caused. As the monthly misery got worse and worse, her patients were thin faster than ever, and her husband and her children began to dread her monthly cycle. Now, let me pause the story for a moment to explain why Janice's body was having such a rough time leading up to and during her period. If you have too much estrogen in your system, which is one common cause in PMS, menstrual cramps, migraines, and things like that, the liver has trouble breaking it down. That can lead to hormone imbalance. Other things that we see is that we may have problems with other hormones. And using a naturopathic approach, what I aim for is helping the body to bring itself back into balance naturally. That's why it's sustainable. The balance is built from the inside rather than being induced through pharmaceuticals, which can then require more drugs later on down the line to offset the side effects from the original ones. My goal is to help my patients support their body's natural ability to maintain their hormonal balance. That's what I mean by being empowered with your health. To do that, I focus on supporting the liver. The liver is our body's filter. All of the blood moves through the liver in order to be cleansed of toxins and impurities. Think of its function like your kitchen sink's drain screen. Its job is to capture the food particles, and so that all that gunk doesn't go down the drain and clog it up. Then once the screen is full, you clean it out so that water flows through and can filter out the junk again. When your liver is having trouble, it can have difficulty filtering out excessive amounts of certain hormones like estrogen, which can then build up in the blood and be carried to the brain and cause PMS symptoms like insomnia, headaches, nausea, yo-yoing emotions, and all the rest. In addition, we are a nation of plastics. Plastics have all sorts of harmful chemicals. One of them is a compound called xenoestrogens. These are plastic compounds that have estrogen-like effects in the body. In addition to contributing to PMS, they are also a risk factor for breast cancer. I will get back to Janice's story in a moment, but before I go on, I wanted to pause to remind those who are just joining us that we offer a no-charge phone consultation, so you can talk with me personally about any health concerns you may have and about how to feel empowered with your health. Arranging a consultation is very easy. All the contact information is on our Facebook page. With Janice, the over-the-counter medication and coffee weren't nearly enough to manage the pain, and she went to her doctor. After a brief visit, her doctor recommended stronger pain medications and also recommended birth control pills. She asked if she would need to be on that regimen forever, and the doctor smiled and said, "Only until menopause." When she heard that, something clicked and she knew she needed to try a different direction. She told me, "I don't want to just be taking stronger and stronger pain medication the rest of my life and damage my liver. I don't like having my concerns just brushed off and trying to put a band-aid on the problem." After our first visit, I spent most of my time, and my standard office visits are 1 hour, taking a detailed medical history. This was at our first visit. We decided on a course of action, starting with additional lab tests to explain more about her hormone levels. At her second visit, I went over the tests with Janice and I explained that her hormone levels were severely imbalanced, but that there was no need for hormone therapy. We could help her body naturally recover its balance. I could actually see the relief in her face as the worry and concern left her body. I prescribed homeopathic remedies and Chinese herbs that helped to balance her hormones and support the liver. Janice followed my homeopathic and herbal regimen and used a special liver cleanse I gave her, and she started seeing changes her very next period. If you're having PMS issues, I can suggest some supplements that are available in our online store. While I can't offer a medical protocol with specific items and dosages like I did with Janice without seeing people as a patient, there are products that you could try and see if they help. If you find you need guidance, then you can always call the office and arrange a free consultation to talk with me. And as with everything, if you are interested in these, make sure that you talk with your doctor first. The following products are two of the many that I commonly use for my patients. The others require individual customization. And again, as I mentioned, this is not medical advice per se. It's something that you need to make sure that you talk with your doctor or talk with a doctor who is well trained in natural medicine to make sure that it's safe for your condition, to make sure that it's not interacting with any medications that you're taking. So these are two of the products that I commonly use. One is called Chase Tree Berry by Gaia Herbs. This is an herb that helps to increase progesterone. And as I mentioned, oftentimes we tend to see this imbalance where there's too much estrogen and there can be not enough progesterone. So Chase Tree Berry is something that helps to rebalance that estrogen progesterone disconnect if there is an imbalance there. Another supplement that I commonly use is something called DIM Detox by Pure Encapsulations. This contains nutrients that support the liver in breaking down abnormally high levels of estrogen and other hormones. You can find these supplements and many others at our online store on our website. They all come with a 20% discount off of the retail prices, and 100% of the proceeds go to a fund to support treatment for children with autism and special needs. You'll find the link in our store at the video post on our Facebook page, or you can just go to drtaketa-wong.com. That's drtaketa-wong.com, all one word, and click on store. As her condition continued to improve, it was like a miracle for Janice. So I wanted to share with you the rest of her story. For the first time in years, she had no headaches or cramps around her menstrual cycle. She didn't have migraines the day before her period. And I want to share what Janice wrote to me. She said, "I couldn't believe it. I thought it was just a random occurrence, but I've continued the treatment and haven't had a headache since. That, along with other remedies, have improved my health dramatically. I sleep well, I feel calmer. It's totally amazing." The final chapter of this patient's story has to do with food. She and her children were already eating healthfully, mostly whole foods and lots of it organic. Typically, I would do food allergy and sensitivity testing, but she had previously tried taking gluten and dairy out of her diet and she felt better with that. However, over time, she just kind of drifted away from that and she was eating more of a typical American diet and she wasn't feeling as good. She was drifting away because it was hard to maintain, and she told me that she'd felt better, and so I told her, since she had felt better, I told her to try stopping gluten and dairy again to see if we could get even more improvement. And it was hard at first. It wasn't easy, but she did find that she was feeling better when she took gluten and dairy out of her diet again. Now, this is not a one-size-fits-all cure. There are some patients that that's not the answer, but for her, it made a huge difference. And she realized that there was still a lot of great food that she could still enjoy, and working with me gave her the knowledge and the emotional support that she needed. I also had a lot of tips and recipes and websites that helped her in that transition to find a diet that she could really enjoy. And that change made a big difference for her and for her family as well. She learned that even if we eat good food overall, the body can still have imbalances. And that's really empowering, because once you understand how your body works, you can do something about it on your own. This patient has been having normal periods for several years now. She continued to make adjustments, and all of her symptoms are completely gone and have never come back. Janice has no headaches, no mood swings, no menstrual cramps. She calls the healing her little miracle. Only she says it with a wink because we both know it's not so little. There's more to my treatment protocol than finding and addressing the underlying causes of disease. When you think about it, the naturopathic approach is a way of empowering people. I can assist them in understanding what is happening in their bodies and why, and I can use this knowledge to to have them take greater command of their own health and well-being. For example, today we learned that PMS can be treated without having to resort to hormone therapy and pain medication. And we found that the naturopathic approach first tests to determine the causes for each individual person and then prescribes an individualized protocol to help treat those specific problems. I trust that our discussion about PMS has been useful to you. Does your doctor take the time to educate you like we're doing here today? If not, you are welcome to talk with me personally about any health concerns that you may have, and so that you too can feel empowered about your health. To do so, just call or text our office to schedule a free phone consultation with me. There's no charge because I don't take patients without talking to them first. I always want to make sure that what I do fits their needs. You'll find all of the contact information on our Facebook page, and you can also click on the link in the post with this video. Mahalo, thank you again for joining us, and I look forward to seeing you in another 2 weeks. Aloha.